Welcome back to the Chatty Vets Pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
Welcome to our first podcast of July, our next 2-week Takedown episode.
This is where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
Right, we've got a busy show today, covering loads of topics from Purina's new Handbook, which is basically an amazing update on just about everything in vet med that you'll ever see by some of the best people in the entire world.
Not that Brendan likes it or anything.
Yeah, I was just staring at it for about 2.5 hours. I just thought, oh my God, it's all like the most amazing people writing, and it's just so easy to read. I loved it.
So not only are we going to be covering Brendan's favourite new thing, but we're also going to be touching on things like polycystic kidney disease and some new advances in osteoarthritis management. So it's going to be a good one. But just before we get started, there's a couple of things we wanted to mention. The first thing we wanted to say is that next week is the podcast we've been really excited about for such a long time. It's the second of our chronic pain management series with a very, very special guest.
Yeah, we've been so excited about this for so long that I've actually almost forgotten who it was now because it's just gone on and I've got so excited. But yeah, there's only one person it can be anyway, really, isn't there? Chronic pain. But anyway, the surprise guest will be announced on Wednesday, so keep your eyes peeled.
Yeah, you're not going to want to miss it, trust us. And the next thing we wanted to mention, in case you haven't seen on our socials, on Tuesday the 1st of July this year, we're hosting our first ever CPD event.
Yeah, and we can't wait. We're running our first of our new grad survival series CPD events. We're calling it the New Grad Consult Survival Day. So if you're a final year vet student, just started in practice in your first year and struggling to find your feet, then this day is for you.
Yeah, it's completely online. It's only a one-day event and it's only 60 quid, so nice and cheap for a full day of CPD for you. We just wanted to help you get prepared for the scary bits in practice. So we'll be covering everything from how to chat to your clients, how to do your bread and butter vaccine and preventative healthcare consults,
how to deal with common day everyday consults that you're going to be doing, vomiting, diarrhea consult, the itchy skin consult, the not quite right consult. And essentially, we're just kind of pooling together our years of kind of how to handle it. It's not necessarily a medical thing. It's how you handle the client, how you keep them with you, how you keep their trust in you by how you handle things.
Yeah, absolutely. And we're going to try and help you out with those really tricky emotional consults as well, such as the ones where clients can't afford treatment, they're being quite argumentative, also the big one, euthanasias.
Yeah, so if you're interested, we've still got a few tickets left, but they won't be there for long. Check the link in the show notes or check out the socials or the website and sign up.
Yeah, we hope to see you there. Anyway, let's dive into the podcast. But just before we get started with something a bit more clinical, we wanted to touch on a big thing in the vet news that's been happening at the moment that seems to have been dragging on forever, but it feels like hopefully we're getting a little bit of headway now. The Vet Surgeons Reform Act. Brendan, have you still been following this or have you just forgotten about it?
I'm going to do a silent protest and not talk about it. I'm so over it. It's just going to boil down to nothing, isn't it? I don't know.
I feel like it was all a massive thing when it initially came out. Hopefully a lot of people filled in their feedback form, but then it's all sort of gone a bit quiet. But what I can say is that there has been something in the news recently that said that on Wednesday, the 24th of June, there actually was a meeting in the House of Commons to discuss it. And hopefully it does sound like the ball is rolling in the right direction, which is good. So there are lots of people now pledging their support for things like the mandatory regulation of vet practices, protection of the RVN title, massive one, modernised fitness to practice regime, and then also the ability to regulate allied professionals, so things like equine dental techs and stuff like that. But I wondered as well, do you think that's going to also link to groomers and descaling? Because, you know, there's this massive movement now for all groomers to descale. So I wonder whether that will then come under it as well. Don't know.
You're right, it's a big deal. I don't know if I get in trouble if I say there's pros, but there's pros and cons to that whole thing, isn't there? But yeah. I think that the dogs could be slightly traumatized if you're trying to do a conscious descale. I mean, you know, that's where.
But also the whole
tricky.
point is the majority of the crap that you want to get out is up under the gum line. You're never going to get that conscious anyway. But I think the good thing is it sounds like hopefully we're heading in the right direction, and fingers crossed it won't all boil down to nothing, and fingers crossed something good will come out of it, but we'll just have to see. But it does sound like there's also been a little bit of movement with the CMA report in the last few months too. After the CMA released their final report earlier in the year, the BVA have actually now released a massive resource to help practices sort of come to terms with all the changes. Basically, the CMA report came and said that we need to make changes to the way that we give our prescription information and the way that we put information about our treatment information and policies, our prices and services, how to manage our out of hours contract, how to choose cremation services, how to manage complaints, blah, blah, blah. Basically, the BVA have set up a guide that walks you through step by step what you need to change and by when and how to change it, which is really good. So if anyone's a practice manager or is doing any sort of business in veterinary, and or even if you're just a vet in practice and is going, I don't really know how this is going to affect me, have a little look at the BVA website because they have set up some guidelines which breaks it down a little bit more. It makes it all a little bit easier to understand. But anyway, that's enough of that because we're all fed up of talking about it. But I just thought it was worth pinpointing people towards to let you know that there have been some changes, which is good.
Yes. Is this where I start talking about transactional capitalism and then everyone turns off? I don't know. Well, yeah, because Aidan, who I work with, the vet who I work with, sent me this video and it took me about 3 months to look at it. But it was really cool because he said, "Oh, you're going to really like this. You're going to really like this." So it's about this guy. He's an older guy, right? So this is when he was younger. He used to go to the same newsagents to get. I think he used to get his packet of cigarettes and matches from this newsagent every morning on his train ride to work. And then one day he went in and he'd forgotten his wallet. And he said, "Oh, can I just borrow 60p to give him enough money to buy his train ticket or something like that?" Anyway, the shopkeeper, even though he'd known him for like 5 years and every day he'd come into the same place, the shopkeeper was like, "No, I can't just give you 60p for your train ticket." And the guy was like, "Right, well," he goes, "Well, fair enough. I get you, yeah." But he never went back to that newsagents ever again because the way he saw it is he had violated parts of the transaction that you have a contract, right? You might say, well, this is the price, something, this is what you pay it there. There's unwritten social rules about times of business relationships. They're not written down anywhere, but you can imagine why. And I think I'd feel the same if someone said no. And that's what I thought
Yeah.
was interesting.
Yeah. I mean, if you put that into a veterinary practice perspective, it is definitely all about that trust thing, isn't it? And sometimes it's not hard and fast rules. I mean, I don't know, if you've had like a really complex medical case and someone spent thousands of pounds with you trying to get their animal better, and then you bring it in for a recheck, it might be just not charging a recheck consult when they come back in 2 days later. It's things like that. You don't always have to be quite so by the book. And the little changes like that isn't going to really mean that the company misses out on much, means a lot to the client because they think, oh, thank you. Like I've spent a lot of money. We've gone through a hell of a lot with you, and it's just nice to be able to say that little thank you.
Though we were chatting just before the episode, weren't we, about these subscription services where you have unlimited consults, which are starting to kind of get more popular. I think that's where feeding into the same thing. You're seeing the animal all the time and you're putting the animal's health first. And then if you do that, all the other things you want to do spring from that, don't they?
Yeah.
So that's
Yeah,
where
definitely.
yeah.
But anyway, right, that's the business bit done. We've probably had loads of people turn off already. So
Oh,
hopefully.
thanks.
No, it was me harping on about the CMA report.
Well, that's quite good. That's all right. No, you did well there. I listened to most of it.
Anyway, but let's move on to something a bit more clinical, shall we? So we wanted to actually take a minute to say a massive thank you here to Purina Institute for sponsoring this episode. So Purina Institute got in touch with us a little while ago about their handbook for well pet nutrition, which, like, don't stop listening here. Like, it sounds a little bit dry, but honestly, we love it. And we were a little bit skeptical to start off with, but it's bloody brilliant. So it's been released brand new to 2026, and we really felt we needed to talk about it today.
But do you know what? In a way, I'm slightly gutted that they've sponsored us because now if I sound really effusive about it, it's going to sound like, but I think it's brilliant. It's just a brilliant update from the top people in the field updating. Because I don't know, for me, when I read it, I didn't really think nutrition. I just thought medical update on everything, whether it's cardiomyopathy, kidney disease, epilepsy. It's just brilliant. And it's like a 5-minute update, and then there's nice little kind of flow charts for diagnostics. It's free. And it's like, bam, you can just get the info straight away on a PDF. I'm going to keep it on my phone.
It's really good. So for anybody who hasn't come across it yet, which I'm sure will probably be quite a lot of people at the moment, it's a new handbook that they've brought out for this year. It was made by 54 different experts. So there's been a hell of a lot of collaboration to get it together, working across different countries. So Brendan's had his little fangirl moment, sort of looking at all the people that have done it because they're all your fave people in the world.
They are.
Yeah.
I'm still excited. I didn't even get to talk about, right, number one, my favorite person in the whole world, Jackie Rand. I just followed her for so many years. Jackie Rand basically was the person that, and others, I'd have to say, pushing for low carb diets for cats that are diabetic and against the mainstream. I noticed the diabetic section on dogs. She's authored as well, and she mentions about low glycemic index dog food for diabetic dogs and basal insulins and the value of those. Holger Volk on epilepsy, because there's all that talk about ketogenic diets for kids reducing epilepsy. So then people thinking, well, could ketogenic diets work in animals? So this was kind of like, because it definitely works in children with epilepsy. And there's a whole little bit on that as well. And it's really cool because I didn't know this, but dogs aren't very good at going ketogenic
Mm.
like humans. So humans go ketogenic on a low carb diet really easily, but dogs don't do that. They're more likely to go into gluconeogenesis and make glucose rather than go down the ketone route and make ketone bodies. So you can't, those low ketone diets weren't working in epileptic dogs because of that issue. But really cool point. He makes the point, which is so clever. I never understood this. They always go on about MCT, medium chain triglycerides. So the idea of the medium chain triglycerides is they get converted to ketones really easily. So it's kind of like you're trying to create a more ketogenic diet. But what you do is instead of going ultra low carb and not having the carbs so that's shifting you to ketones, which dogs aren't good at. You give them the medium chain triglycerides, which get converted into ketones. So you're kind of trying to do the same thing in a more canine way to help with
Okay.
their epilepsy. And
Yeah.
yes,
It is really good. And I mean, coming from someone who's actually not crazy into nutrition
no.
compared to other stuff, it's actually really interesting, and it breaks it down in such a really good way. So it's intended as like a practical guide for veterinary teams to manage healthy, well dogs and cats rather than ones that are really, really sick. But basically, it's talking about nutrition in the context of everything from lifelong health, body condition, MSK development, cognitive function, etc. And it breaks it down to say nutrition is so individualized and it has to be about the patient rather than a generic cat or dog. Breaks it down into life stages and how we can support animals through those life stages, as well as things like pregnancy and lactation. It talks about proactive nutrition. It gives some really handy bits in there as well, like some brilliant figures to talk to owners about. Like there's one part that says when we're talking about obesity and the massive crisis that we're having in dogs and cats everywhere, there's some really great figures that you can chat to owners about. They've said that there's lean-fed group of animals in one study had a 15% longer lifespan than dogs and cats that were being fed a lot more food, and also delayed onset of chronic disease. So you've got figures you can speak to owners about. And they've also got great tools like a diet history form for owners to fill in to help you get information from them. It's really, really good. I think as well, generally, nutrition is something that we just don't know enough about. I think the majority of vets in practice know that it's important, but don't really know how to speak to owners about it. Or do you think it's because we just don't have time to speak to them? What do you think it is?
honestly, I read this handbook and
Mm,
it's to me, it's not nutrition, it's medicine. So I think if
yeah,
you're interested in medicine, look at it because I promise you, you're going to love it.
yeah.
It's the interaction between. Oh my God, I've just remembered a section on kidneys, right? The number one, the author's absolutely brilliant. And it's gut health as pertaining to cat's kidney disease. And so, like, you know how we've always been focused on, or I've always been focused on low protein, low phosphate. So essentially phosphates in protein. So if you lower the protein, you lower the phosphate. That's the cornerstone of kidney management. Oh my God, I've forgotten her name now. She's so good. She's done all these publications on how the gut kidney axis, its toxic metabolants in the gut are causing damage to the kidneys and perpetuating chronic kidney disease, and how managing the gut health, and it's looking at the gut bacteria and things like that, are actually really influential in kidney health in cats. So, like, that's medicine. It's that nutrition is like nutrition. We did that cortisol, we did the Cushing's episode, and I was talking about ketotic diets. Like, medicine, this is all just medicine now. There's no nutrition and medicine. Don't separate. And this handbook shows it. And it shouldn't read like a nutrition manual. It doesn't. To me, it reads like a genuine clinical update on all the
Yeah.
important things that we do, because it isn't limited to nutrition, and it's not biased. It doesn't kind of go, and that's why you should feed Purina renal disease. It's none of it links back to the food. It is just purely a resource. So yeah, it's like the best. It's free. It's the best thing in the entire world, as far as I'm concerned.
Yeah, it's really good. I think it's just structured so it's so easy to use as well, isn't it? I mean, yes, you've got the beginning bits where it goes through like your micro and macronutrients and stuff. So it gives you the proper nutritional information at the beginning, but it's more clinical, like you said. It gets broken down into how to apply it to the different life stages, how to apply it to different disease processes. So, how to support healthy joints. So in your arthritic animals as they're aging, it's just really useful. And I think anybody who's ever been a bit stuck or doesn't really know how to talk to their clients about nutrition, and like you say, anybody who's really interested in medicine, complex medical cases, nutrition is such a massive part of, and lifelong health, nutrition is such a massive part of. So if you really want to do the best for your patients, really get yourself up on this handbook. One of the things that made me this handbook specifically made me think about is whether we should actually be thinking about doing more dedicated nutrition consults. Like how in practices, nurses will offer weight clinics for cats and dogs and things like that. And you do sort of your flea and worm checks and you have dedicated consults for different things. I really wonder whether we should be offering, like when anybody signs up to like a pet health plan, whether it also says every 3 months or every 6 months or whatever, you have a dedicated nutrition consult and you sit down, you talk about diet and you say, okay, where are you? What's your life stage? Should you be feeding that sort of food at the moment? What sort of things can you be considering? I really do wonder whether there's more that we could be doing there.
Yeah, I like it. I mean, fish
Mm,
oils for skin, that's covered in the handbook I read. I
mhm,
was reading about that and how beneficial that is.
mm,
It touches on the kind of overblown elements of gluten and in relation to
mm.
paroxysmal dyskinesia. Because
Yeah.
I think because the thing is, it's becoming an issue because clients are getting this on their social media, aren't they? So
Mhm,
I think that could be the reason why it's getting more and more important to kind of get stuck into it. Because
mm.
otherwise, the client's going to be listening to something on Instagram and they're off down that tangent.
Yeah.
So yeah, it gives them.
Yeah.
We don't have to go against people. Just yeah, it gives them another perspective or our perspective.
Exactly. And I think that's the thing is that people are learning so much of social media, what they read online nowadays, that they come in already having an idea of thinking that they know what the best nutrition is for their pet. And if we're not discussing it with them, that's all the information they're getting. So it'd be really good for us as professionals to be able to say, well, hang on a minute, this is where we come from. This is what we would suggest for your specific pet, not just some generic stuff you've read online. When we did that RVN episode and we said about how it'd be really nice to really push our RVNs more and get them to do more in practice and feel like they have more of a central role. If anybody that's listening to this loves nutrition and really wants to have a bit more of a dedicated role in their practice, take this handbook to your bosses and say, I'd really like to properly start doing some consults and, start talking to clients about what they're feeding and why, and use this as a resource to really get ahead and to really put the animals first and say, this is what we think that you could be feeding and why
Yeah,
maybe this isn't the right diet for your pets. Like, use it. It's so useful. I think if people use this, I think it will elevate your consults hugely, elevate your practice hugely, really be a great thing for your dogs and cats. So definitely have a little look at it.
is
Yeah.
so cool. I hope they
Yeah,
keep
exactly. So
updating it every year as
yeah.
well. It's
Yeah,
cool.
exactly. So, but anyway, we've harped on about it for long enough. But if you are interested, we've put the link in the show notes for you. It's available in 7 different languages and it's completely free to download. You don't have to pay for it. So we'll put some links on our socials as well, but get it downloaded on your phone. Anyway, moving on from nutrition, we wanted to chat about something completely different now, as we both had a couple of weird kidney cases recently, haven't we, Brendan?
Yeah, I was in a moral dilemma actually because I had a lovely older lady with her 12-year-old Yorkie that she was just like, she would do anything. But that, in a way, is the most stressful thing for me as a vet, I find, because it's like I have to get a good outcome. Well, not, I don't, that it doesn't mean fixing the dog always, but a good outcome in every sense of that, a good experience for her and her pet.
Mm.
But it was Friday evening when I finally got round to looking at the lab results that I'd sent off to the external lab because I wanted to get, because it was like mild GI signs and weight loss and stuff. And so I wasn't expecting kidney disease. So then when the results come, 4 p.m. Friday, creatinine 234. And I was so mildly elevated, but that is frightening. And I thought, because this dog is so fussy, I thought it's a Yorkie. I have to hospitalize it for the weekend. I have to sentence her out of hours. She's going to spend so much of the budget, even though I think she would have spent anything on this dog. But she could have easily spent 2-3 grand over the weekend. And the thing is, it'd get admitted, it wouldn't eat, it'd probably get worse. And I had this moral dilemma. What do I do? Do I send it to out of hours? And in the end, I probably did the wrong thing. And I kind of said, look, if things get much worse, obviously you have to go to the out of hours, but let's see you Monday morning and just keep tenting, which is probably the wrong thing to do. I didn't want
Yeah,
her to
it's
come
hard.
with, spent £3,000 on a Monday and then I can't do anything.
Yeah, but the thing is as well is that when you're in that stage, you don't know whether it's pre-renal azotemia, right? You don't know whether it's dehydrated and it's because of the GI signs and that's why they're elevated, in which case, yeah, you'd want to hospitalise it. But when you say you did the wrong thing, reading your notes on the case, I'm not sure that you did do the wrong thing in the end because you rechecked the dog, didn't you?
Yeah, but I was terrified because I thought it's cracking going to be 500. And
Mm,
then she would have been able to say to me, "But why didn't you send me to the out of hours for fluids?" And I'd have paid
mm,
£3,000. I would have been fine.
yeah.
I panicked. I didn't know what to do. Anyway,
Mm.
amazingly, how could this even happen? She comes in Monday, creatinine's now 144.
I mean, if it started eating better and it started drinking more itself and it sort of diuresed itself, then yes, in effect, because it's just doing that instead of IV fluids, isn't it?
Careful with that term diurese there from an ECC perspective, by the way. But
Diuresed, yeah. Yeah,
rehydrated it himself.
yeah.
Anyway, I scanned him, and then the other weird thing that happened, he bloody had polycystic kidneys, which he's not a Persian cat.
Yeah.
How? But literally black round holes,
Mm.
hypoechoic round black patches on ultrasound, dotted throughout like Swiss cheese. His kidneys, like about 12 to 15 on each kidney, 5 to 10 mils round. Have you had a polycystic Yorkshire Terrier?
Weird, weird. Unless it wasn't polycystic and it's tumours.
No. It's a good point. Good point. Well, it looks now, and Brendan's second error that is now broadcast on all major podcast listing platforms.
Is
When
the
this
dog
comes
still
to
fine?
court, I think so. I saw her walking a dog in the park on the way home from work.
Oh, well, there you go. It's all right. It's azotemia's resolved, so you're all good.
Bloody hell. Yeah, good point. Probably a
Yeah.
really thorough vet would have at this point have had some needle aspirates from the kidney and diagnosed
Oh,
carcinoma. But
yeah.
anyway, I was like, it's got polycystic kidneys.
I've had a few cats, but never had a dog. Weird. But I had a weird case recently as well. I was working, it was probably like 11 p.m. These people rushed their cat in because it'd been hit by a car. It was still ambulatory and stuff. And actually, touch wood, it had done pretty well considering it had been hit, had like a few minor scrapes and stuff. But anyway, because I could tell it had quite a trauma, I kept it in overnight and kept doing sort of an A pocus and T pocus through the night to make sure nothing was changing. But it did have a really mild, similar to you, it did have a really mild azotemia when I admitted it. So I was obviously like, well, it's probably pre-renals, probably shocky. I'm going to put it on fluids anyway, blah, blah, blah.
And hopefully you got a urine sample and checked a USG before you started it on shock fluids. Or
Well, it's a cat. How are you supposed to? I mean, it had a teeny tiny bladder. I wasn't going to cysto it. It's a teeny tiny bladder. I was like, it needs fluid. Anyway,
Charlotte, I've mentioned quickly that dressing down I got from the internal medic, and I'm so glad she did dress me down about it. She was so angry because I hadn't got a urine sample from a cat that I saw as a consult and I put it on fluids because she couldn't tell if it was pre-renal or renal. And I've never forgotten the telling off I got.
yeah, I do get it. And I mean, it's much easier for a dog because you can be like, great, if they're ambulatory, take them out and see if they need a wee. Or if they've got a big bladder, then you can cysto them, fine. But when they come in and they've normally weed themselves when they've been hit by a car anyway, they're really painful. So you don't want to squeeze them. You don't want to sedate them to do a cysto and they're too painful for you to do it conscious. What are you supposed to do? It's a cat. It's not going to wee in the kennel for you, is it? It's like, anyway, anyway.
Take it for a walk and get it to wee on the
Yeah,
grass.
exactly. Yeah. But anyway, I did an APOCUS, and I was like, great, no free fluid, bladder's intact, gallbladder's intact, blah, blah, blah. Diaphragm looks great. T-POCUS is fine. Oh, hang on, what's this? I had polycystic kidneys. They didn't even know. So it was like a 10-year-old cat. But the really frustrating thing is their insurance, the payment had not gone through like 4 days before, so they were no longer insured. And I'd obviously just had to tell them their cat has polycystic kidney disease, so they're never going to be covered for it, which is a nightmare. But anyway, so yeah, it's just really interesting. It just shows how important it is to do those apocuses whenever there is something like that going on, because you do pick up on things. You know, if you hadn't have scanned that dog, you wouldn't have found them. You would have just thought I was probably pre-renal azotemia, especially because it had resolved. I would have thought it's pre-renal azotemia because it'd been hit by a car. It just shows how important it is to scan. But
Right.
anyways, polycystic kidney cases, it's, if anybody's never had one before, it's just to remind you, basically it's a progressive genetic condition. There's no cure for it. You basically manage it like you would any of your other CKD cases. So have a recheck of the IRIS guidelines if you're not really sure what to do. But generally it's renal diets, monitoring their blood pressure, monitoring their proteinuria, etc. So have a recheck of the IRIS guidelines if you're not sure what to do, but just manage them like you would a CKD case. With CKD, even though there's guidelines, I find that every individual vet deals with these cases so differently. Like we all have our own opinions and ways of approaching them and things that we might do first, ways that we sell it to clients or talk to them about it. And there's a few other topics we wanted to discuss here that I think are really similar and everyone does something really different. So we wanted to get your opinions on. So please do get in touch with us about this. Remember, you can get in touch on WhatsApp. We love voice notes. So please voice note us or message us on social media, on Brendan's blog posts, etc. But the first one we wanted to chat about was quite a big one. When do you cancel or postpone your bitch space? So you had one recently, Brendan, that you were like, do I cancel it? Do I keep going? What do I do? Obviously, if something's like obviously lactating and it's really clearly in a false pregnancy, fine, you postpone. But where's that line? Because you've had one recently, haven't you?
Yeah, I had one, and every mammary gland I could get watery secretion out of, like very reliably too. Because I mean, there is a temptation to make your day a bit easier. Just go, oh no, that one's off. There's one drop of secretion coming out of that nipple, but it's like every one, and I could get about 3, 4 without any effort at all. I was like, well, it's not milk, it's water. Does that mean it's at the end? But it's coming out reliably, not just the back two, but every one. So I chatted to the nurse, as I always do in any kind of dilemma situation, and she was like, "Well, just talk to the client and ask them what they think." And I thought, oh, "Okay, that's cool." So I chatted, and the owner was like, sometimes they'll go, "Oh, I've taken a day off work and I've got the blood,
Yeah, yeah,
the whole week," and then you're like, "Okay, fine, just do it, whatever." But this lady was like, "No, no problem. I'll just come and get her. No, I'll just get her. No, I'll just do it next, whatever." And I was
yeah,
like, "Oh, easy, dilemma over."
yeah.
So, but I don't know if anyone's ever taught me, if it's just water, what do you do? I don't know. Is
Yeah. I think it's that really fine line, isn't it? To be honest, I mean, the only time that I've had one where I've had that massive dilemma, generally, if I've ever had any secretion, I've said, no, let's delay it just in case. Unless you have that conversation, they're like, no, we want to do it anyway. And you explain the risks and they say, no, let's go carry on. The only one I've had is that I had one where I checked a couple of teats when I was admitting. I was really busy. And I was like, quick, get them in, get them in. Anyway, it was on the table. And I don't know why I did it, clipping her abdomen. And I just squeezed one of the teats higher up. And there was a little bit of that watery stuff. And I thought, for God's sake. But I was like, yeah, it was only one teat. The owner had explicitly asked, is she showing any sorts of nesting or any different behaviours at home, etc. And I carried on, and her uterus was tiny. There was no massive engorged blood vessels or anything. It was absolutely fine, and there were no issues afterwards. I let them know after, and she was already asleep. So, but I think it's just that discussion, isn't it? I think as long as you warn owners, but I think realistically, if there's any secretion there, whether it's water or whether it's milk, we should be having that chat with them because there's still that risk, isn't there?
I had another one, which I don't know if I have mentioned this to you before, but do you remember it was a bitch that was 6 months from her last season, but she wasn't in season visibly to the owner. But the
Mm.
problem is the nurse had done the admit and it was in, and I felt like we were at the point where we are going to operate, and she'd even, I think, had the pre-op bloods and things. And I thought, can't really turn this around now because it's kind of did for a bitch they, they've gone over everything, and so in the end, I just ended up going on with it. But she was definitely friable on her ovarian ligaments because I remember it, and two further down the pedicle, at two different points at the same time. And I thought that's a bit bloody, but it just made me think that could have been a silent
Mm. A
season.
silent heat, yeah.
Yeah, and I
Yeah.
wouldn't normally operate 6 months after a season, even
No.
if there was no visible season.
Mm.
But
Yeah.
yeah, so that's another one where I don't know what other people are. You don't often get into that situation, but yeah,
No,
it's
yeah,
worth
it can
bringing
be
it up.
tricky though. Yeah, definitely. And because I know we get a lot of students listening as well. For anybody that's listening that doesn't really know, 'cause I know you get taught at vet school why we do it at certain times, but I don't really think anybody ever really clearly explains why. But basically, if you spay a dog during a false pregnancy, so when they have any milk or that watery secretion, it dramatically drops your progesterone. And that drop triggers a rapid spike in prolactin, which is the hormone responsible for your milk production, which can cause the false pregnancy symptoms. And it basically can then mean that those symptoms can persist for a hell of a lot longer than they would do normally, or potentially even become a chronic state, which is why we worry so much about spaying them when they are potentially showing symptoms of a false pregnancy, because it can mean that they can potentially, worst case scenario, be in that state for a really super long time. So if you're ever in doubt, I wouldn't go ahead. But yeah, it's just interesting to see where people's line is. So if anybody has a cutoff where they're like yes to this and no to that, then let us know. So
Yeah, and I don't know the ins and outs of it, but I remember one vet saying to me, "Oh, well, that's not an issue anymore because we've got the prolactin antagonists or whatever."
mm,
But I don't know if they're making prolactin all the time. Then when you stop the prolactin antagonist, will that mean they'll still be back into phantom pregnancy
yeah,
again? So if
yeah,
it is, but yeah,
because I guess you use it to bring them out of their normal false pregnancies, which are self-limiting anyway. You're just shortening the length of it, right? Whereas if you have a chronic state, I don't know actually. I don't know whether it'd help them bring it out of it.
yeah. But then they do seem to stop when you do the course. So does it? Yeah,
Yeah.
there we go.
Okay. And the next little thing. So you're a bit different to me on this. I don't think I really do this, sedating patients for ultrasounds. So, because you tend to sedate your patients to do a good abdominal ultrasound, don't you?
Well, I wouldn't say I tend to, but look. Do you know what I've done? I've got both because in GP, the ultrasound is a different thing to ECC, isn't it?
Mm,
You are there's much more detail. You're looking for. I don't think you want to miss anything when you do a GP abdo ultrasound. Whereas when you do an ECC ultrasound, you're answering set questions about their
mm,
urgent state, aren't you? And when you want that fine detail, boy, does the sedation make it easier. So the context is everything. Also, you've often got a fairly well patient, so sedation becomes a safer thing to do. I do find a panting dog trying to get, even though I've been ultrasounding for 24, 5 years, I find a panting dog so irritating to scan. Don't you know what I mean? Also, I'm really focused in GP work on stress to the patient. And however much people go, my dog's fine, you'll be all right. If I can minimize stress, I
mm,
just think that's really important for the future of the next
mm.
time we have to handle that dog.
Yeah.
And I just perceive medetomidine as just being such a great way to minimize stress.
Yeah. I think as well, it depends on the type of dog as well, doesn't it? If you've got a really big, deep chested, large breed dog where everything in the abdomen is sitting up underneath the rib cage, you try and
Yeah,
ultrasound them conscious and you're like, cool, I can see a kidney and a bladder. And that's about it because everything else is tucked up. Whereas if you
yeah.
sedate them, they relax, everything drops down a little bit and you get a much clearer view of everything. But the way that I normally talk about ultrasound to clients is, especially if it's something where you could do ultrasound or you could do x-rays, you say, well, x-rays I have to sedate because I have to keep them still. Ultrasounds I could do conscious.
Yeah.
And a lot of people would choose ultrasound because they don't want to go for sedation. So I guess that's the only caveat I would give. But sedation can make it way easier, can't it?
It's context, isn't it? It's yeah.
Mm,
If it's is it a pyometra or not, then obviously or a bladder stone. But you're right, actually. You made a really good point. It's the cranial abdomen that's a bit tricky. Because
mm,
yeah, I can do jejunal measurements, bladder, is it a pyo? And to some extent kidneys, okay. But yeah, you're
mm.
right, the cranial abdomen, mainly the liver and gallbladder and that panting in
Yeah,
a deep chested. I think you're right,
yeah.
that's one of the harder
It's one of the
ones.
hardest ones.
Yeah. It's great if you've got a good nursing team that can sedate, clean and gel. Then by the time you go in, the skin's all softened up with the gel and you just get
Mm,
such great detail. But yeah,
mm.
there you are. But sedate, yeah, is a good thing. We had a
Yeah.
really cool thing on another topic. There was that amazing. There was a guy that sent in a message, Chris Izard, and it was really cool because he was bringing up the point about owners, and this is getting more and more. I'm finding L4 is dangerous. We don't want L4, and then there's that whole
Yeah.
chat. But also, and just because it happens all the time, we just get used to it. People giving non-evidence things to fix their pet or prevent fleas or worm them with diatomaceous earth and
Mhm.
garlic powder. And do you know what? I thought it's true actually, because we don't go on about that as much as we should.
No, there's just so many products that are just marketed so well, aren't they? I mean, you think of all of the flea products that you have that are out there, and none of them really work. But there's like flea creams, there's flea bombs, there's
Yeah.
flea sprays, there's all the stuff that you can get that they're like the number one product in the
Electric flea
UK or
cut.
whatever.
Yeah.
Yeah, exactly. And it all gets sold so well. And I think actually the reason why that sells really well for fleas is anybody who's ever had kids and has combed nits out of their kids' hair, they think of it, it works the same way. So they think like a cream or a
Yeah,
shampoo and combs is going to work the same way, but it doesn't.
yeah.
I think it is just the marketing, isn't it? And then they come in and they're like, "Oh, it's itchy, but it's definitely not fleas because I've been using all this crap." And you think, "Oh, okay, just have this 3 months product that's definitely going to work. Thanks."
As you said, yeah, exactly. As you said that about marketing, I just thought there was a cat dry food, and it said something like lowest carb in the world or highest protein in the world or something. Anyway, I went on to my vetvin.com and I was messaging online with one of the nutrition people who's actually in that handbook as well. She was so cool. And between me and her, well, obviously her, we analyzed the ingredients and stuff. And it was so funny because when we got to the end of the calculation, it was basically exactly the same as every other cat food. But yet it's being marketed as like highest protein or lowest
Yeah,
carb in the world dry food.
yeah,
And it was just like, wow, that is
yeah.
such a big deal. And
I
these
know.
things are happening all around us. But you can't, or you almost get to the point where it's like politics. You can't call it out and people just go, no, I don't know, Trump derangement syndrome or whatever, you're just one of those because because you're
Yeah.
calling it out. It's so
Yeah.
frustrating.
And people just buy into it so much with loads of things. And the L4 thing is a massive thing, isn't it? It's all breeders. It's really difficult to get them to. And it's when they speak to the clients about it as well. And they've already come in and had their first vaccine with L2 somewhere. And then they're like, oh, the breeder told me not to get L4 because it'd kill my dog. And you think, oh, for God's sake. And then you have to backtrack and basically tell them that that's wrong. It makes life so
Do you know,
difficult, doesn't it?
yeah, I say something along the lines of, well, okay, yeah, we don't have to vaccinate for L4, but that leptospirosis is in stagnant water and swimming in canals. And if your dog is like a little chihuahua that tiptoes around puddles and never goes out and lives in your house or whatever, there is low risk. So I kind of try and get across about the risk. And then I'll say something like,
Yeah.
but it can be a real pain when, like, I had a dog, because this does happen to me. I have a dog with liver parameters up. But because it's not vaccinated against leptospirosis, it's a really difficult thing to diagnose. I now have to do loads of extra tests to see if it's
Mm.
that, because that is treatable, which I wouldn't have to do if it was vaccinated. And I'll go, well, yeah, we did have that dog that died of lepto a couple of years ago.
I think I'd do the same. If they're a really low risk dog, then fine. But I think I do say it more from the fact of I've seen dogs die of leptospirosis, and if you ever saw a dog with it, you would want
Yeah.
to vaccinate against L4. And I make that point. And if that's not enough to make them switch to L4 from L2, then don't really know what will be. So I don't scare people, but I just say, if she was mine and she was an at risk dog, then I would be vaccinating for L4. And I think that's one of the situations that I do feel quite okay in myself to go, if this was my dog, I would do that because that's what I do. It's just me being honest.
I'll add one other thing though, because being older, and I can remember pre the internet being really widespread with info. Ever since the internet, they hate campaigns against new drugs. So,
Mm,
like now, I bet you any drug of the last 15, 20 years, you can put it in and find a hate group that comes up
mm.
with, my dog had that and then it died the
Yeah.
next week, you know. So, that was clearly
Yeah.
that killed it. And I think that is something we need to educate people on, is that I will say to them, look, any new drug now will have, this is part of it. You will get a hate group which will
Mm,
associate something negative that's happened with that drug. And especially a drug you give every month or every year,
mm.
they're going to be the prime candidates because they're obviously something's going to happen to someone's pet within a few weeks
Yeah.
of giving a monthly product.
Well, that's why
That's
so many of the side effects are on the data sheets, because if someone reports a possible side effect, like, I don't know, they've had an L4 vaccine and then 3 days later they've come in with some horrible immune condition, and you're like, well, there's no way of being able to prove that causal relationship, but you also can't disprove it. So they have to put it as a possible side effect on the data sheet, right? Because if it's had that drug and then 3 days later, so it might be completely coincidental. I think that's the dangerous thing as well, isn't it? It's just because things are listed on the data sheet doesn't mean that that's definitely going to happen because of the drug. It's just that it could happen because it happened in one case, and we can't say that it's not related. So it's such a tricky one, isn't it? But
well,
trying to
yeah.
advise owners of that is really hard.
What do you do with, like Nexgar, Bravecto, and all these isoxazolines? I don't never
Mm,
say it right.
mm.
They're not meant to be given with epilepsy, are they? Or the neuro kind of potential risks?
Do you know what?
Or
I
is that
didn't
not
even know
something on
that.
your horizon?
I
Why
didn't even
people?
know.
I feel like that is something that's got some validity.
Yeah, I didn't even know that. I've literally just looked it up now. So the FDA has warned that isoxazoline drugs, which can include Bravecto, etc., can cause neurological adverse reactions in dogs, such as muscle tremors, ataxia, and seizures. So because of the risks, we typically recommend against using those sort of drugs in dogs with pre-existing epilepsy. I bet you so many people don't even know that. That's really interesting. So,
Yeah, that is. I think that's a little thing. There you go.
But anyway, if any of you guys have an opinion on what we've been chatting about, we would love to hear from you. So remember, you can get in touch with us in all the usual ways. So please do get in touch. We'd love to hear from you. And remember as well that these pods are made for vet professionals, but we can only keep making the podcast if more people keep listening. So please spread the word to your friends and colleagues, etc. So give us a rate on Spotify and Apple Podcasts and spread the word to people you know. So we want to keep producing them for you because hopefully you're all enjoying them still. But anyway, so we got a couple of products we want to chat about. We want to sort of tell you about some new stuff that's come to the market. So we've talked in a previous podcast about arthritis management and using bed-in-vet-mab and how there was massive hoo-ha about it last year and whether we should still be using it or not, blah, blah, blah. And we will talk a little bit more about that next week. So have a little listen to our special guest podcast. But there's actually something new that's come to the market. I don't even know whether you can get it yet, but it's just got approval. Have you heard about Lenivia?
I have not. This looks amazing. Go on.
We can't sort of say whether it's going to be any good or not because nobody's ever used it yet. But the VMD, so this was on the 28th of May, apparently this year. So Zoetis announced that the VMD has approved Lenivia, which is zenivetmab. It's an injection that you give for the alleviation of pain associated with osteoarthritis in dogs. So apparently they say that it's got a decade of science and research behind it. It's a new antibody therapy, which showed in their studies, it showed that dogs receiving it experience improved mobility and reduced pain after a single injection. And apparently it lasts for 3 months. So you only have to give it every 3 months. And it acts by novel binding to nerve growth factor, a recognized mediator of pain and inflammation. So I guess watch this space. So there's something new coming out.
Well, it sounds like a 3-month version of the Librela, doesn't it? Different bit on the nerve growth factor.
The other new one that we wanted to talk about is, so for ages, there's been no product that, for ears we're talking about now, there's been no product that just does one particular thing. So everything seems to have the steroid, the antibiotic and the antifungal all together. But there's so many of them where we see malassezia infections where it's just red and inflamed and it's got malassezia, probably because it's got an underlying allergic condition. And you're giving antibiotic when we don't need to be. But there's now this new product out there.
It arrived on our shelf about 2 weeks ago. But I've used it 2 or 3 times, but I see a need for it because I do 2 out of 3 I do cytology for, and the vast majority, no bacteria. It's just heaps and heaps of snowmen, I call them, malassezia. And I don't need the antibiotic, I perceive. But until, watch this space, I'll come back in a 2 or 3 months and see what. But the other thing is it's long acting. So you've got a long acting antifungal steroid. It feels like it's going to be a winner.
It's just nice to know that we've now got an array of options to choose from. So something that is bacterial, you've got those ones that have the antibiotic in. Something that is just fungal, you've got something that does not have the antibiotic in, which is great. So it's just nice to have that option rather than using it when we don't need to. So yeah.
Yeah, do you know what? For 25 years, people always go, why are you bothering doing ear cytologies? And every time I'm like, well, I just mutter something because I don't really have a good answer because we haven't really got any other bloody options. But now I've got an option. Like, okay, I haven't seen bacteria. I can go with an antifungal steroid.
Yeah.
Anyway.
So now circling back to arthritis management, going off that sort of Lenivia conversation, and aging dogs. I chatted to BSAVA PetSavers a while ago, that charity organisation, about what they're doing. They also mentioned to us about something else that I think people should know about. They've actually got something called the Canine Aging Toolkit, and it's similar to the nutrition handbook. There's like a downloadable resource, but it's actually for owners and it can help educate owners about their aging dogs. So it sounds really generic, but actually had a look, it's quite good. And you can download it, give it to owners or print it off in your practice or tell owners to download it. And it basically says what owners should expect when dogs get a bit older, what to look out for. So things like dental disease, joint disease, etc. And I actually think, when clients come in and they've already got like a 12-year-old Labrador and it's really arthritic already, and they're like, oh, they're all right, they're just slowing down. If you think, it's really difficult at that point to get clients on board with any of your treatment plans or options for doing more, etc., because they're at that point and they just think they're slowing down. Where I think there's actually a real sort of niche time where we could be speaking to clients when dogs hit 6-7 years of age be giving them something like this booklet and saying, these are the things that you're likely to expect to start happening in the next few years. Keep an eye out for them. When you start to see any of these symptoms, come back and we can have a chat about what we do next. It plants the seed, because then it means that hopefully you're getting people on board before they actually start to see any of the signs. So it's free to access again as well. I just thought it's worth pointing out because it could be a really good thing to get clients on board with.
I like the checklist. That's really good. You could get them to do that questionnaire in the back. If there's any red
Mm,
flags on there, then, you can look at the section relating to that. Because,
mm,
yeah, most clients, especially with their aging Labrador, they don't realize that they're panting and slowing down his joint pain, do
no,
they? As
no.
much as we go on about this.
Yeah,
So
exactly.
it covers all that. Is your pet struggling with getting up the stairs? How often will I do a consult? Oh, he's been struggling for 18 months, going down the stairs. Well, it's oh,
Yeah.
he's just getting old. Yeah,
Yeah,
that is just
exactly.
so
Yeah,
there's a
he's getting
need
old,
for
but it's
it, isn't
also
there?
really painful. Yeah.
Yeah. Yeah. And then when you tell them
God.
he's panting as a sign of pain, they're like, "No way." I think I like it, but I'd do it backwards. I'd start with
Mm,
the questionnaire, and then that will motivate them to then look into the sections relevant to them. Oh, it's an
yeah.
end of life thingy too.
Yeah. No, it's good. So yeah, it's just another
Yeah.
resource if you want to have a little look online. It's something else to have a think about.
Okay, yeah. One final thing just to touch on before we finish up, but how much veterinary practice is changing and the support out there and tech changes and all of this. But, also the fact that clients are now coming in pre-armed with AI, and that information is pretty on the ball. So, yeah, we're facing a big increase in the challenge of being a vet.
Yeah, definitely. I think there's so much technological change, so much change in the way that we're running practices, so much change in the way that we're communicating with clients. Everything is changing so much. And basically, what we wanted to mention here is that sometimes it's worth looking elsewhere for a bit of help. So, we've actually been chatting to Vet Shadow recently about a really exciting prospect for veterinary practices that we wanted to share with you.
Yeah, I think this is essentially utilizing technology to give you more a colleague support right when you need it. And also I think there's little things I was saying to you, Charlotte, there's little things that crop up through the day where you benefit from a little quick bit of info or bit of guidance.
Mm,
By the end of the day, you're just too knackered to think about it.
mm.
So it's kind of trying to be like that kind of person on your shoulder, just giving you a bit of advice.
I mean, we've all been in situations before where we felt out of our depth, or maybe you work in a practice where you don't feel that supported, or maybe you've got a great support network, but you work overnight and you sometimes struggle to get help when you're working sole charge and it's really early hours of the morning. So, Vet Shadow are actually a company that aim to provide that help for you. So, they're like a subscription service that you subscribe to as a practice, not as an individual. And they provide clinicians that are available around the clock for sort of a network of really experienced senior vet specialists that can offer real time case advice and support on your triages, give you second opinions, and they can basically help you to get really hands on with your cases when you might be a little bit stuck.
And the advice can come pretty quick as well. So
Mm,
it can really just help get you through the day. There is times, isn't there, my boss is busy he's in theatre, someone else is consulting, or it's the third thing in the day, and you don't want to bug your
mm,
colleagues with every single thing. It's
yeah.
really nice to have someone that you can guilt-free
Yeah.
utilize for that kind of info that gets to know you as well, because of that relationship they're developing. They get to
Mm,
know what your clients are like, what your skills are like. There's no point in going, well,
mm,
the answer to this question is you do a left atrial measurement, and they if someone knows your skill set, they know what equipment
mm,
and challenges you face within your practice, how much time you have available. Getting that kind of tailored advice that suits your situation
yeah.
is amazing.
Yeah, and I think the difference from, because obviously we've always been able to call referral centres and wait on the phone for like an hour to speak to someone or get someone call you back. So there's always been those sort of services. But the really nice thing with this is that you can text them, you can voice note them, you can send photos. So say for example you've admitted a medical case and you're like, what the hell is going on? You send them the information, keep consulting, and then keep checking your phone in between. And you can deal with it that way. You're getting really great advice from somebody else that might be able to help you, and it's still not taking up extra time in your day, which is amazing. I mean, do you remember, Brendan, when I was chatting to you about that new grad vet that was working sole charge, and she thought it was, I think I mentioned it in the podcast, and she was calling around loads of practices to get help because she thought she had a cat with a diaphragmatic hernia, and it turned out to be a thromboembolism cat. And you just think, if that person had just had access to this and just been able to really quickly send some pictures or voice call someone and say, like, help, what the hell do I do? That animal would have been so much better off because it probably would have been put to sleep about hour and a half, 2 hours before it was, because it was so painful for so long. I mean, we all know how painful those thrombos are. I think this could be super, super useful. So if you are in a clinic where you're really busy, or you are sole charge, or you think actually a bit of extra help could be really useful, they sound like it could be a really, really good thing to get on board with. So
Yeah, like for blood results, by the way, I had a new grad that unfortunately didn't realize the significance of the potassium being 8. So they didn't
mm,
realize it was something they needed to flag up.
mm,
So even if it's just, you can take it nowadays, so we just take a screenshot or take a picture on your phone, send it to Vet Shadow or whatever, get someone just to go, is there anything I need to immediately panic about right now
mm,
and avoid? Because that ended up being a bit of a like, I felt for her actually, because, you're not going to know every thing is there's so much to learn, isn't there? And in
yeah,
any moment of the day, you might drop the ball on something. We
yeah,
can't be
exactly.
perfect, and
No,
we're under
exactly.
pressure. So
Yeah,
yeah,
exactly.
support's probably the biggest thing we're lacking, isn't it?
Yeah,
I would
yeah.
say all
But
of
also,
us.
it's not even support in practice, because you can be in a practice where you feel really supported, but if everyone is really busy, it's
Yeah,
time. I think that's
yeah.
half of it, isn't it? I have it sometimes where if I have a really busy shift and I've got a really complex medical case that's come in, and I think I need to sit down and reevaluate all your blood results and rack my brain as to exactly what I'm going to do with you. But sometimes you just don't have time. So it'd be really nice to send off the results to someone and be like, I'm thinking of doing this as my initial plan. You've got someone that can sit there and take half an hour and actually think, actually, maybe I do this, or consider this, or consider this. And it's just like someone being next to you, bouncing off ideas, but you have time to do it, which is so nice. So I think it could be a really, really good option for a lot of practices.
And there's packages that are day and night, aren't they? So if it's in the evening or whatever, your boss has gone home, you've still got support.
Exactly. And to
Or
be honest,
weekends.
because some people might think as well, well, we don't need it. We've got Monday to Friday during the day. We have loads of people and we've got loads of support. We don't really need it. But actually, maybe if you have people that are on call, or you have a sole charge person overnight or at the weekends, maybe that's when you need it. And they can do that too. They don't necessarily just have to do 24/7. So it's really worth getting in touch with them if you're interested.
Yeah, I was gonna say, do you know what? Now I am the older person sometimes. We often don't know what the hell's this well, we know what we wanna do in a case.
Yeah.
We don't know if that's the best thing to do. We're just
No.
doing what we think's the best thing. So when
Mm.
a younger vet asks me something, I think, bloody, I feel like saying, I don't know. It's just what I do. It might be absolutely rubbish. And but you can't say that because then the poor person's going to feel like even more worried. So you just kind
Yeah.
of go, well, you do this and that and you sound all knowledgeable. But deep down, you are like, am I just filling them with my mistakes? So
Mm.
having someone with either more specialism or more time or more whatever to take over some of that aspect, and then you're
Yeah.
elevating the whole practice beyond you rather
Mm.
than up to you.
I think we're always learning. It's not just for people that feel like they're out of their depth. It's for everyone, because I think that anybody that turns around and says that they can manage any case on their own without any help is someone that probably should think about whether they want to still be practicing, because we should always be learning. We should always be taking advice from other people, and sort of thinking about new ways that we can be improving and doing things. So yeah, it's just a really great option if anybody's interested. So there's a dedicated link that you can click on through us. So we've put the link in the show notes. And also, because we really like them and we've actually partnered with them now, they've actually been willing to give you guys 5% discount for listening to the podcast, which is really good. So if you are interested, then use the promo code Chatty5. We'll put it in the show notes anyway, so that you can remember. Click on the link that's on there and have a little look. And if you're interested, then have a chat to them and see where it goes.
Yeah, it felt like they were kind of trying to do what we're doing, aren't they? Trying to give support to GP vets, in a GP way. And I feel like that's what they're trying to do. And any of us kind of necessarily trying to do that. So yeah, okay. So time to round up because we've covered loads today with Purina new handbook, which I can't be more effusive about. We also did the new drug for osteoarthritis pain management and much, much more.
Yeah, so we hope as ever you've enjoyed listening, and remember to get in touch, as we keep harping on about, if you have any comments or suggestions to help us improve these pods for you, any topics you particularly want to cover, etc. So remember, you've got the blog, you've got our WhatsApp number and the socials to contact us through. So please do get in touch.
Absolutely. But for now, thank you for listening. Join us again next Sunday for our ridiculously exciting bonus episode with the most amazing person in the world. We can't wait for you to hear it.
Yeah, we're honestly so excited. We hope you're looking forward to it just as much as we are. Keep an eye out on our socials in the meantime for updates. And remember, if you're interested in our CPD event on the 21st of July, link is in the show notes and on our socials. But until then, it's bye from me.
Bye from me. Take care. This podcast is intended for licensed veterinary professionals and is provided for educational and discussion purposes only. Whilst it is publicly accessible, it is not intended as advice for pet owners.
The views shared are based on our own clinical experience and interpretation and do not replace individual clinical judgment. We accept no responsibility for decisions made based on this content, and all cases should be assessed on an individual basis.
Any references to medications, treatments, or products are made for educational discussion only and are not intended to promote or advertise veterinary medicines to the general public. Veterinary medicine should only be used under the direction of a prescribing veterinary surgeon and in accordance with the UK veterinary medicine regulations.
This podcast may include paid partnerships or sponsorships. These do not influence our clinical opinions, and any sponsored content will be clearly identified.